Hello ladies and gentlemen, this is Dr.Haris, a graduate of dental surgery from Lahore, and in this video we'll talk about the periodontal ligament. The periodontal ligament is a specialized soft connective tissue which covers the cementum of the root and the socket of the alveolar bone, and it serves the purpose of attaching the tooth to the bone. So it is the periodontal ligament which is actually suspending and attaching the tooth with the bone. The tooth is not directly fused with the bone. In some cases, when we find that the tooth is fused with the bone, that phenomenon is known as ankylosis, and that is an abnormal finding. The periodontal ligament has many fiber bundles. It has a variety of cells inside it, and it has a ground substance which is mostly water but also has some proteoglycans inside it. In the cells, we have the epithelial cell rests of Malassez, the undifferentiated ectomesenchymal cells, the stem cells. Now the stem cells give the evidence that the periodontal ligament can repair and regenerate itself in case of an injury, and the most important cells of the periodontal ligament, the fibroblasts. The fibroblasts of the PDL are unique. They can contract, they are attached to adjacent fibroblasts via cell junctions, and they also show a phenomenon which is called as functional adaptation. Now, when the tooth in its function and when the patient can easily masticate, the forces of mastication alter the functions of the fibroblast. When there's increased function, the fibroblast synthesizes more collagen and more ground substance. However, when there is a lack of function, the fibroblasts appear to secrete less collagen and less ground substance, and this leads to the thinning of the periodontal ligament. Now we come on a very important aspect, which are the fibers. Now the fibers of the PDL are divided in two groups. Their principal function is to connect the tooth with the alveolar bone, and the fibers which serve this purpose, the purpose of attachment, are known as the principal fibers. Now they are divided into 5 groups. First we have the alveolar crest group. Now these are the fibers which actually connect the cementum of the tooth with the alveolar crest. The alveolar crest is the highest point of the socket, and it is directly below the cemento-enamel junction. Next we have the horizontal group of fibers. These fibers are apical to or below the alveolar crest fibers, and they run at right angle to the long axis of the tooth. Next we have the oblique group of fibers, which obliquely run from the cementum to the alveolar bone, and they are the most numerous and the abundant fibers of the principal group of periodontal fibers. And then we have the apical group. Now the apical group of fibers withstand the highest stress of mastication, and they show the greatest turnover of fibers. In this region, the collagen fibers are greatly synthesized and greatly removed. And lastly, we have the interradicular group, which is only and only found in the multi-rooted teeth. Secondly, the periodontal group of fibers are divided into the gingival group of fibers. Now these fibers do not connect the tooth with the alveolar bone. However, these fibers originate from the tooth or the bone, and then they end up in the gingiva. Therefore, they are known as the gingival group of fibers. Now in this group, we have the dentogingival group, which is originating from the cervical cementum of the tooth and going towards the gingiva. Then we have the alveolo-gingival group, which runs from the alveolar crest, ends up in gingiva. Then we have the circular group of fibers, which forms the band around the tooth, around the neck of the tooth, and it encircles the tooth. Then we have the dentoperiosteal group, which runs apically from the cementum over the cortical plate and then inserts into the floor of the mouth. And lastly, the most important of the gingival unit of fibers are the transcetal fibers. The transcetal fibers basically connect the cementum of one tooth to the cementum of the adjacent tooth. And these fibers connect all the teeth in the arch. And these are the fibers which are responsible for relapse after an orthodontic treatment. The gingival group of fibers are responsible for maintaining the integrity of the periodontal ligament. Now, in addition to the collagen fibers, we also have elastic fibers, and the elastic fibers found in the periodontal ligament are known as the oxytocin fibers. Interestingly, these fibers connect the cementum of the tooth with the blood vessels. So when there is excessive function or increased demand of function from the periodontal ligament, these fibers can increase the blood flow to the periodontal ligament. They're very important. Now, coming on to the functions of the periodontal ligament, the periodontal ligament actually supports and connects the tooth with the alveolar bone. Pedial ligament also has a pedial fluid inside it which cushions the tooth from the stresses. It has very important function of sensation. The periodontal ligament is loaded with nerves and nerve endings. Many types of mechanoreceptors are inside it. Interestingly, whenever there is an object that is stuck between two teeth, such as any food particle or any bone particle, it is the periodontal ligament which tells you its location. In those people who have implants instead of natural teeth, they are unable to differentiate when an object is strapped between two teeth which are implanted inside the oral cavity. And this proves that the periodontal ligament actually serves the purpose of sensation. There are no periodontal ligaments around a dental implant. Then we have the nutritive function of the periodontal ligament. The periodontal ligament, like its nerve supply, has an abundant blood supply. And therefore, the blood supply nourishes the tooth and the periodontal ligament. Lastly, we have the homeostatic function. Like I said before, the periodontal ligament has a variety of cells. It has stem cells, it has cells of the bone and cementum. Therefore, the periodontal ligament basically maintains the structure of the cementum and the alveolar bone because of the cells that are present inside it. And this is all about the periodontal ligament. I want you to learn as much about it as you can. If you like this video, give a thumbs up. If you have any questions, ask in the comment section below. Do not forget to subscribe to my channel. This is Dr. Haris. Thank you very much.